let's begin. So, today I'm going to talk about a real challenge which most of the healthcare organizations, doctors, and providers face, that is telehealth credentialing. As our topic says, scaling without borders, strategies for mass multi state credentialing in the virtual era, which means nothing but expanding telehealth credentialing into various states, how they can apply for various payers in different states, and what obstacles they face, and how to overcome that. Let's have a look at it. Before we proceed in our webinar, I want to introduce myself quickly. My name is Chanky, and I'm one of the customer success managers here at Capline. We are a company that helps healthcare organizations to get their credentialing done in an easier way so that the providers and the doctors can start seeing patients and they can start earning revenue without any unnecessary delay. When you talk about credentialing, it is quite complex procedure. Many healthcare providers and doctors go through them and they are well aware about it. And most of them, they don't even know how to overcome that obstacles. We are going to cover every bit of it in this webinar. And just before we start with our webinar, I want to let you know about Capline Healthcare Management more. We are a revenue cycle management company. We are not just limited to credentialing. We provide the various types of services, be it insurance verification, patient communication, digital marketing, billing and collections, pretty much every service which a provider needs or a healthcare organization needs. Let's proceed further. All right, I'll start with a real situation. Just imagine a group of healthcare providers wins a major contract for telehealthcare services in various states. Now, the doctors are ready, technology is in place, platform is ready, but even after 90 days, they are not able to bill a single claim. Does anyone know the reason behind this? All right, let me tell you why. Because nobody handled their credentialing on time. As I told you, in today's webinar, we will be discussing about it, like how we can get the credentialing done without getting delayed so that providers and the healthcare can start seeing patients and start earning revenues for their healthcare organizations. Now, what if I tell you you could credential a provider in less than 30 days instead of 120? Because I'm pretty much sure most of us must be thinking that it takes like at least, somewhere around 90 to 110 days. And if we are going for the state plans like Medicaid and Medicare, they can take more than that. So we'll see how can we reduce that timeline in today's webinar. Let's move forward. The telehealth expansion paradox. Telehealth has grown like never before. More doctors are seeing the patients online across the state line, which is a great news for us. Now, just think about it. If you are expanding into various states, that will pile up your credentialing work more. That means every state has their different dental and medical boards, which a provider needs to get credentialed with. Now, if we talk about the guidelines, they have the different fee structures, they have the different documentations, they have the different guidelines as per the different board. We are going to cover each and everything in today's webinar. Also, every state has its own medical board, which means they will come up with their own rules as well. If any of the rules is not followed, that can lead into neglect application. Just a moment, we have more people joining in. Just give me 1 minute. All right, we're good to go. So let's begin. So all the state boards and the medical boards, be it for dental provider, be it for medical provider, they have their own guidelines, which has to be followed thoroughly by the healthcare organizations. I'll let you know how we can minimize the errors so that the application which has been submitted for the credentialing can be approved in a one single go rather than getting it declined and applying it for it over and over again. Let's move forward. Now let's talk about money because this is where it hurts the most. For every new state, providers must enroll with each payer separately, be it Medicare, Medicaid, and let's say any other commercial plans. A 10-state expansion can mean 80 plus payer applications. Let's say we have a couple of providers under our organization and we are expanding into 10 states and we have various payers to get enrolled with. That needs a whole lot of time to get the credentialing approved. Also, now your provider is working for your organization, but they cannot earn until and unless they are credentialed with that particular payer. So they are working, but they are not getting anything in return. Also, let's say if at a random scale, if 3 to 5 providers are delayed in a group, that could lead up to like $1 million for a quarter's revenue loss for that particular organization. That is a huge amount. Most of the organizations are losing money at that scale, and they're not aware about it, how to overcome that. We'll see how we can manage it. All right, let's move forward. I'm so sorry, I have someone to joining in. Okay, so let's have a look at our agenda today. So we'll be talking about the credentialing crisis in the virtual care. Then we'll be hopping on to CMS and PECOS rules in 2026, because these are the two important bodies when we talk about the credentialing. Then we'll be talking about the biggest challenges which occur when you apply for the credentialing in different states and their solutions. Then we'll see the credentialing at scale. Moving forward, we'll see on-demand automation. That means, AI bots and what all tools are available so that we can use to minimize our work for the credentialing. And in the last but not the least, we'll be talking about a 90-day action plan, and we'll be covering all the questions which you have. All right, let's go. Why 2026 is the tipping point? Does anyone know, like, what does it mean? Anything like anything you which comes in your mind? Is it regarding the credentialing, or is it regarding to the provider? Why does it call tipping point? Why does the 2026 is considered as tipping point? No? All right, I'll tell you. So I'll start with the first point. 44 states now have active telehealth laws. Telehealth is no longer temporary thing, it's a permanent thing. CMS, I'm pretty much sure most of us don't know about CMS. It's a government body which manages Medicare. CMS has their own rules. Now, each provider has to get credentialed with each state of Medicare. Let's say a provider is applying for 3 to 5 states, he has to get himself enrolled into each Medicare state separately. Cross program termination, one CMS revocation now cascades across Medicare, Medicare, and CHIP. So it is not limited to just one payer. Once the revocation has been done for the provider, it goes like a chain to the other payers as well. Dental and medical specialists expanding virtuality phase 10 to 15 simultaneous state credentialing applications, which means if you are applying for 10 to 15 applications, it should be done simultaneously, not one by one. It will be time saver for you, a massive time saver, I would say. Last but not the least, PECOS is now the authoritative source of truth. PECOS, you can take it as a single source of truth or data, which means if nothing matches PECOS, the records. I'll give you an example. Let's say there's a provider and he has enrolled himself into Delta Dental, one of the Medicaid, or let's say a commercial plan. Now, that particular dental payer will try to verify the details through PECOS. Now, I'll tell you the fun fact is, let's say a minor mistake of that provider, let's say the address of that particular practice, the suite number was missing, that claim will be declined. That particular provider wouldn't be getting anything for that particular claim. So PECOS plays the important role when it comes about the telehealth credentialing, or be it the same state credentialing as well. All right, let's move forward. Navigating through CMS and PECOS. So I'll divide this into three parts so that we can have a better understanding about it. CMS enrollment rules. The very first, separate Medicare enrollment is required per state of service. That means by enrolling into just one Medicare for that particular state, you cannot see the other state Medicare patients. You have to have yourself enrolled into that particular state Medicare as well. Let's say you're going with 10 to 12 states, you make sure that you are credentialed with each state Medicare. PECOS is a single source of truth. Internal data must match exactly. Your data in PECOS should be updated thoroughly. Make sure if you're making any changes, be it in your address, be it in your taxonomy, everything should be updated because payers they verify and matches all the information through PECOS itself. Revocation in one program triggers a cross-program cascade across Medicaid and CHIP. If the revocation has been done in any of the payers, it goes like a chain to other payers as well, and there is no mercy when it comes for the provider. Now let's move to the PECOS. We'll talk about the PECOS in detail. Reconcile internal credentialing data with PECOS records monthly. Monitor enrollment status proactively across all the payers. Make sure whatever application you're trying to apply for, you check what's the application status. Prior to that, you see if the panel is closed or open, then only you apply for that. Let's say you applied for a particular payer and their panel is closed, that would be a time waster for you guys. Audit practice locations and effective dates, CMS flags, mismatches. As I told you, if there is a discrepancy in the address, well, let's say there's a provider who wants to expand his telehealth services to any other state. So he has to make sure that he provides the telehealth services address as well, along with the physical address. It wouldn't be possible without both of them. Either of them is missing, your claim would be denied in the very first go. Home telehealth location designate, as I told you, home health location should be there in PECOS itself. It should be registered over there. Multi-state pitfalls. Telehealth practitioners must be licensed in each patient state. Separate MAC per state at application complexity. Dental specialties, each state has distinct board credentialing timelines. As I told you, every state has their own medical and dental board. They have their own timelines. Some have 60 to 90 days. uh, you could see the other board has like 90 to 110 days. They vary. They are not just limited to one fixed timeline. So you make sure that you whatever pair you are going for, you read, research about it, and then apply for it. Let's move forward. All right, let's try to dive into PECOS a little bit more because I'm pretty much sure most of us don't even know what does PECOS they do exactly and what important role they do play while the provider is getting credentialed. So I'll divide this segment into four parts. I'll start with the very first one, provider eligibility gate. Every Medicare claim is validated against PECOS in real-time basis. An enrolled provider means automatic claim rejection, no exceptions. So you have to make sure that the provider is enrolled in PECOS and into the payers as well before applying for the claim. If either of them is missing, the claim will get denied for sure. Practice location registry. Each practice location, including home telehealth address, must be separately registered. Telehealth only locations require administrative telehealth only designations. Make sure when you're going for telehealth services, you register your telehealth service home address as well. It doesn't mean that the provider would be able to see the patients while sitting into other states and registering the physical address of that particular state. But you have to make sure that you register the address wherein you are targeting the patients itself. Moving on to the other one, revalidation life cycle. PICO tracks all revalidation deadlines. Missing a deadline triggers deactivation, not just a warning. Automatic calendar integration is essential. So if revalidation deadlines are over, and I'm sure most of us don't keep a track on it, there is no warning from the PICOs. It shall be eliminated on the very much moment. Last but not the least, group and individual enrollment. Both the individual provider and the group practice must be enrolled. Missing either entity breaks the billing chain entirely for the state. Let's say there's a provider and you are applying for the group claim. You have to make sure that provider is credentialed on the group NPI as well. If that hasn't been done, either of them is missing, the claim will be denied as well. All right. Now, since we talk about what does PICO controls, now let's see the small errors which deny the claims as perspective of PICOs and how we can take care of those small errors. So I'll start with the very first one, that is NPI mismatch. So I'll tell you there are two types of NPI, NPI type 1 and NPI type 2. NPI type 1 is basically this organizational NPI, my bad. NPI type 1 is basically the individual NPI, and the NPI type 2 is the organizational based NPI. Both of them should be registered in PECOS correctly. If that particular mismatch, then the claim would be denied. Moving on to the second one, that is address discrepancy. So I'll give you an example. There's a provider who wants to get enrolled with a Medicare board, and he gives his physical location address. Now in that particular address, he forgot to add the suite number. This small suite number can decline the claim in the very first go. So you make sure that you go thoroughly through the address, you see it, and then you apply for it. Specialty code error, wrong taxonomy code, of course, decline in the claim. Let's say there is a provider and his specialty taxonomy code is not registered in PECOS correctly. That would deny the claim as well. Moving on to the other one, missing reassignment. If the provider is not reassigned to the group, claims denied at the group level. As I told you in the previous slide, if the provider is not enrolled into the group credentialing separately, apart than the individual credentialing, that would lead to the denial of the claim as well. Let's have the look at the other one, that is lapse revalidation. Auto deactivation after missed deadline, no grace period. Uh, let's say if a provider is enrolled with any of the payers, after 2 or 3 months, he needs himself to get re-credentialed with that particular payer. If that is missed, no warning will be given by the PECOS, and that would be denied in the very first go. So you see, all all small things which we can take care of. These are the major factors that are leading to the revenue loss for most of the healthcare organizations. Let's have a look at the last one, which says telehealth location error. We have repeated it multiple times, but I'll tell you once again. If the home address not designated as telehealth only triggers compliance review. Now, let's say there is an address which you registered in the PECOS and that address is not designated as telehealth services. That would also lead to the denial of the claim. So you have to make sure that you take care of all these very precisely. All right. So since we are talking about this, now we should know the challenges. So we'll talk about the challenges. Let's have a look at the main challenges, which are the manual processes. They create messy, fragmented records. Nobody knows what completed and what's missing. Second would be expired licenses, which lead to higher rejection rates from payers. Moving on to the third one, regulators now demand real-time verification of provider credentials. You cannot rely on automated documents. Last but not the least, fourth one is there is a growing need for continuous monitoring and files that are always audit ready. These are the challenges which occur. Now, since we are talking about the challenges, we should know how to overcome these challenges. So we'll see that into our next slide. So here's how you can solve all the challenges which we just discussed in the previous slide. So I'll start with the very first one. Move everything to a central cloud platform and connect it with your HR and medical record systems. That would make your work easier. The second one, automated license tracking, so you never miss on expiration date. Because if you miss on to expiration date, there's no mercy from PECOS. Your claim would be denied, and you have to start from the scratch. Create one standard profile for every provider that is used everywhere. This prevents duplicacy entries while submitting the applications. Also, build audit-ready files automatically so you are always prepared for any review or any inspection. Any inspection means like, if any payer is trying to check, because their background verification is quite hard. So whenever they're trying to check if the information is correct or not, that should be always, on your fingertips. Moving on to the other slide. These are some key accelerators which can help you to improve your credentialing process. Let's have a look at them. The very first is IMLC. I'll tell you what does it stand for. It stands for Interstate Medical Licensure Compact. This allows physicians to apply for licenses in 40 states with just one single application. It's a massive time saver again. Moving on to the second one, that is CAQH preview. Uh, I'll tell you CAQH, it's a universal platform for the credentialing. It verifies every provider information for payers. Doctors and dentists should keep up their CAQH profile 100%. They should be updated. They should update their certificates, their experience letter, every details which is required in CAQH, because payers, they check it through CAQH. Moving into the last one, which says uniform application for licensor. So I'll tell you what this is. This is a web-based tool that eliminates the need to fill in the same information again and again for different state boards. It can reduce application time from weeks to just a few days. So let's say you are going for um, simple same payers for different states. So it will eliminate the information which has to be submitted over and over again. So I'm pretty much sure these three are most important key accelerators, or I would say the tools. If you use them, they will make your work easier. All right, now let's move forward. Dental specialty credentialing pathways. For dental providers, credentialing is a bit more complex. We'll see how. Teledentistry is now reimbursable in 38 states under Medicaid, but each state Medicaid plan has its own credentialing timeline. Budget at least 60 to 90 days per new state. Each state dental board has its own unique requirements, different exams, certifications, and background checks. Unlike physicians, there is no compact yet for dentists, although it has been developed in 12 states. Oral surgeons and periodontists who prescribe medication needs a separate DEA registration for every state they practice in. Without DEA registration, they wouldn't be able to prescribe medicines to the patients. And for commercial payers like Delta Dental or Cigna, each one requires separate enrollment per state. Always check if a panel is closed or open for any commercial plan you are trying to get credential in. Because let's say if you submitted the application, you did not check if the panel was closed or open. If the panel was closed, then you have to wait at least approximately, I would say, 9 months to apply again for that particular payer. So, good to know knowledge. Please check the panel if that is closed or open before applying for that. All right, let's talk about multi-state payer contracting strategies. Um, I'll I'll divide this into various points so that you can understand it easily. The very first one, before applying anywhere, map out every payer operating in your target states. Prioritize by patient volumes and reimbursement rates provided by the payers. Second, submit all payer applications at the same time, not one by one. Let's say you're going with 9 to 10 applications and you thought that, I would be applying for all of them after one by one. That would consume a hell lot of time. You would start paying patient, you would start seeing patients, but you wouldn't be getting anything for it. So you're working, but you're not getting anything in return. So make sure you apply for all the 9 to 10 applications simultaneously. Third, follow up with every payer every single week. 40% of credentialing delays happen simply because of missing documents or incomplete application. Automated alerts can fix this completely. All right. The fourth one would be contracting versus credentialing. I'm pretty much sure most of us don't know like what's the difference between credentialing and contracting. So I'll tell you. Credentialing means proving that a provider is clinically qualified. It's about the verifications, licenses, and approval for seeing the patients. On the other hand, if you talk about the contracting, it's more about what payer is going to pay that particular provider for seeing a patient. It's about, accepting the fee schedules from that particular payer so that the provider would be getting so and so amount for that so and so surgery. Let's say there is a dental provider, whatever surgery he is going to do for a patient, there would be several codes, there will be a fee schedule for that particular surgery, and he would be getting paid accordingly. Fifth, panel status monitoring. This is very important as we discussed. Closed panel waste our times. Make sure that you check the commercial plans panels. Is it closed or open? If they are open, they are good to go. If they are closed, I would suggest you to wait and try to follow up over and over again with the payers to check if the panel is open again so that you can submit your application once again and get your provider credential. All right. So right now on your screen, the complete credentialing checklist. We have created a simple 16-point checklist that covers everything you need when you are extending into a new state. So I'll tell you what does it cover. I'll just give you a glimpse because this you can take it as a step by step guide for your provider when you try to expand from one state to other. It includes everything from verifying state specific licenses to submitting PECOS enrollment to setting down revalidation calendar alerts. Everything you think of it, and you would find it amongst this guide. I'll just wait for a couple of um, seconds over here so that you guys can have a look at it. All right, let's move forward. On-demand automation. Let me now talk about automation because this is where the real transformation happens. Real-time dashboards give you a complete visibility across all states and all payers in one single screen. AI bots automatically validate documents, run background checks, fill in data 24 hours a day, 7 days a week. RPA, it stands for Robotic Process Automation. It connects directly to CAQH and automates primary source of verification, which used to take days manually, but now you can reduce this up to like 3 to 5 days, or I would say, I mean, generally it's like lesser than 30 days. So if you follow all these AI-driven bots, RPA for CAQH, real-time dashboards, they will minimize the efforts for applying for credentialing application for the different states, different dental boards or medical boards. Let's move forward. So let's have a look at manual versus automated state credentialing. I'll tell you about like this step by step. So I'll show you difference step by step for manual credentialing and automated multi-state credentialing. Manual credentialing takes 90 to 120 days on an average. It involves spreadsheets, fax machines, and constant follow-up. There's no unified view across payers and states, and it costs around $7,500 per delayed provider. That's a massive amount. With automation, credentialing is done in 2 to 5 days. Everything is synced. CAQH, PECOS, and all payers, they are all in one platform. Expiry alerts go out automatically within every 90 to 60 or 30 days. Accuracy level is 99.5% when we compare it from the manual credentialing, and the costs drop by 70%. So the choice is clear to you. Let's move forward. So since we talked about the challenges, we talked about how we can overcome through those challenges, how we can use AI to reduce our efforts for the multi-state credentialing. Now let's have a look at 90-day action plan for US. So here's a practical plan. You can start immediately. I'll tell you day 1 to day 30. Diagnose, audit your PECOS data, find all mismatches, identify which state have enrollment gaps, calculate how long your current credentialing cycle would take from day 31st to day 31st to day 60. Standardize, set up CAQH ProView for all the providers you're applying for, deploy automated expiry tracking, centralize all payer enrollments in one platform. Moving on to the third phase, that is day 61 to day 90, that is scale and optimization. Launch real-time dashboards, run your first automated PECOS reconciliation, measure your results, and keep improving. All right, now let's move on to the other slide, which says KPIs to track and report. Uh, I'll be honest, you cannot improve what you do if you do not measure that. So here are the 6 key numbers to track to make sure that you're on the right track and you are getting enrolled for the particular payer in no time. Let's have a look at it. The very first is cycle time, which means how many days from application to approval. The second one is error rate, how many applications need to be redone. Cost per credential, that is nothing but total cost divided by number of providers credentials so far. Revenue days saved, how many extra billing days you gain by being faster. Expirable compliance, what percentage of licenses are renewed before they expire. And the last but not the least, payer panel fill rate. How many target payers are enrolled within 60 days? So you have to make sure that you keep a target on days, be it 60 or be it 70. You can keep it according to yourself. Make sure that you get the provider credential in that particular time frame. All right. 5 things to act on this week. Here are 5 simple things I want you to take away from today. The very first, 2026 is an enforcement year. CMS, which controls Medicare, has tightened all the rules. Waiting is a revenue risk, not a safe choice. Moving on to the second one, expanding into multiple states without a proper credentialing strategy means months of delays, your provider are working but getting nothing in return. Third, tools like IMLC and CAQH are available right now. Use them proactively so that you know how to reduce the error rate in terms of credentialing. The fourth one, automation is not optional anymore. Manual processes simply cannot scale to 20 plus states. Last but not least, start measuring this week. Know your cycle time, know your revenue at risk, then build your plan accordingly. We'll have some extended part to that, which sees automation is the only path to sustainable multi-state credentialing, my bad, which means you are using AI bots to reduce your error rate. You are keeping a track on the expiration date so that your provider are getting re-credentialed on time and they are getting paid for it. And as I told you, start measuring your performance so that you know your cycle time, your revenue at risk, and build your plan accordingly. All right. So far we have covered so many things about credentialing, expanding it through the various states. I'm pretty much sure you guys have a couple of questions. So let's have a look at the very first one. If I ask you, do you know your current credentialing cycle time per state? What would be the cost of your last credentialing delay? Or how many states is your organization currently credentialed or enrolling providers in? These are some questions I want you guys to think about it and to jot it down and we have already discussed how we can overcome through those. So we'll just wait for a couple of seconds on this slide so that you can jot it down. All right, let's move forward. So far we have discussed a lot many things about it. So don't just take my words for it. Here are some real words from our clients, from dental practices to specialty groups. They all say the same thing. Capline has made it easier for them when it comes about credentialing. I told you, like our motto is to make sure that we make sure that the provider is credentialed in the given timeline in the very first go so that he can start seeing patients and start getting revenue for it. So here are some testimonials from our client, and there is a long chain of the positive clients since we are serving them from like more than 8 years, I would say. You can have a look at it, please. All right, let's move forward. Summary. To bring everything together, credentialing at scale needs 3 things. That is clean data, the right automation tools, and a proactive strategy. When you shift from reactive credentialing to strategic credentialing, you protect your revenue. Sorry, you grow faster and you know how to stay on top of credentialing. I told you, if you are making a particular plan for your credentialing, the targeted audience, the targeted state, the board, very well, the timeline, you have checked the panel, monitoring if that is closed or open, you are halfway down. You would be able to get your provider credential in the very first go. All right. So in today's session, we have covered a lot many things about telehealth expansion. If this session has resonated with you, I would suggest you can book your 15-minute strategy call with us, wherein our credentialing specialist will go through your organization's providers information. They will come up with a plan which could be beneficial for you. I'm pretty much sure about it. So what are you waiting for? You can book your 15-minute strategy call with us, and we are pretty much sure that we will take care of it, and we'll make sure that we turn around it into a positive response from our clients, as we are doing since past 8 years. All right. Thank you guys for joining in.